I myself was diagnosed with cancer at the age of 17, 18, and so finished my last 2 years of high school being treated for Hodgkin's lymphoma and really just interacting with the physicians who helped care for me. I was just really inspired by, how they took care of me, and that ultimately led me to first, having that exposure and wanting to do the same thing to help other patients. So I was trained as a general surgeon, but my specialty is metabolic and bariatric surgery and also foregut surgery. So that means I treat obesity. But then the foregut would include anything from esophageal disorders like achalasia, gastroparesis, which would be specific to the stomach, and then also large paraesophageal hernias. I treat reflux, also known as GERD. If a patient is interested in bariatric surgery, what we do at our office is we help patients maneuver through that process, as easily as possible. So every insurance company has different requirements, whether it's the months that they have to see us, and sometimes even the testing differs between insurance companies. The first visit, we review the patient's past medical, surgical history, also their medications, and the patient and I talk about their goals, not only with weight loss, but also maybe they have other symptoms like reflux that is also really bothersome to them, or perhaps they have severe joint pain and they're dependent on certain medications to treat that pain. That all really factors in to the procedure selection. So it's not a, one size fits all. We really, sit and talk to the patients and decide, which procedure is best suited for that individual patient. For the heartburn or the foregut side of things, every patient also has different goals, and is their goal eventually to have surgery on a hernia, or to address their reflux, or would they rather have a more minimally invasive approach? I love taking care of my patients, and I'm always so happy when they come back and they're happy with their results. One patient's goal was to ride a roller coaster with her children. Another was to be able to, in her words, be a mom. And she described herself formally as a couch mom. And she's like, now I actually go to the park, I go hiking, and I do things with my daughter. And every patient, approaches the surgery with a different goal in mind. And so it's really nice to see them achieve that, or just overall be more mobile and healthy and coming off of sometimes up to 10 medications. It's really rewarding.